Okay, good day everyone. So today, this is our last topic in cardiopulmonary conditions. It's about cardiovascular and pulmonary treatment. So this is an lecture on the actual treatment and how we formulate our physical therapy management with patients having cardiopulmonary conditions. So without further ado, so let's start our discussion. So we have the problem-oriented approach. So the approach here is dependent on the problem of the patient. What is the problem that we can assess during our ocular inspection as well as during our systems review. So once we have already identified this problem, we're going to treat it. We are going to formulate the management for this problem. Okay. So usually, the goals of the physical therapy practice are the promotions of optimal physical wellness and fitness, and the prevention of onset of symptoms and progression of impairments and functional limitations that may result from disease. So, identifying the presence of coronary risk factors and providing guidance regarding lifestyle modifications aimed at reducing their impact are appropriate interventions for physical therapists. So that is usual approach na to. Example, if the patient is having hypertension or obese or metabolic syndrome and diabetes, what is our primary management for this kind of risk factors? So as PTs, personally, let's engage in what? If you have hypertension, how can you control hypertension aside from medications? So basically, we can control it by lifestyle modifications through maybe we apply dust dye, no, or um, controlling the amount of salt intake. So basically, in lifestyle management, or we can say that we give exercises so that the patient is will become active, no, con obesya. So maybe participates in regular aerobic and resistance exercise programs, not only to reduce cardiovascular risk, but also to be familiar with the issues involved in maintaining lifelong physical activities or activity habits to set a positive example for our patients and the public. So as PT, we should engage on this. Uh, Sometimes, not only sometimes, but most of the time, especially those who are involved in academy, since the loading is too heavy or not heavy, busy, no? Kung wala klase, teacher, na ginahimo mag-check og papel, mag-check sa online quizzes, or mag-check sa mga requirements sa estudyante, or sometimes na meetings nga ipatawag. So we need to consider this one, no? So outcome measures. So these are the areas where we can measure our improvement with regards to our goals in order to have an active lifestyle or to improve our lifestyle activity. So first, we can measure sa ato blood pressure. Makontrol na ba nato siya? Ang glucose tolerance nato, cholesterol level sa blood, ah, kung smoker ka, naka-stop na ba ka sa smoking, naka-start na ba ka cut down sa imong cigarette stick consumption, or na-reduce na ba nimo ang adiposity, ang imong body fat percentage, no? So, ang long-term na imong outcomes is what? Reductions of morbidity and mortality. No? So, when you say morbidity, nagdugangan ba ang ihang uh, problem? No? Let's take for example, kung hypertensive lang siya, nahimo na ba siyang diabetes, taas na po yung blood sugar. So, kasabot, nagkakataas-kataas ang morbidity niya no? Or ang complications sa iyang case. So, kung na-reduce na to, gikan dito pananglitan, 5 ka buok ang iyang comorbidities, no? High blood pressure, high cholesterol level, na-reduce na to siya into 3 na lang or 2 na lang siya kabuk. That's a very good outcome, sure. Sa ato ang treatment na improve na ang ato ang lifestyle as physical therapist. So most common probably encountered in patients with cardiovascular and pulmonary disease, as well as those with many other chronic diseases or simply chronic inactivity, is progressively reduced activity tolerance or endurance. This is a common problem kay kung ang patient nato tagaan na exercise. Ya kung maabot ng panahon nga di niya kuan may yun dili ko pwede kanang mao man ingon sa doktor nga di na ko magpalabi. So you notice kung dili siya maghimo sa activity, slowly naga-deteriorate ang conditions, no? So as PT, it's it's up to us to encourage this patient to engage in physical activity that is appropriate to his uh, level of functions, no? We will not rely totally on the doctor. Of course, we need to coordinate with them, but sometimes there are doctors that they want to hook their patients only to them, not to other allied health professionals. Siyempre, normal naman na, no? Economic issues. No, simple naman ganda siya nga term. Bisan kita man nga PT na agyapon ta economic issues that we want to hold our patients nga naagi na sila permi kanunay sa tuwa kay siyempre wala na sila unsa na may ato imo panginabuhian, no? But of course, we need also to look out for the patients that they will not be hooked or for lifetime dito sa imuha as PT. No? Kada adlaw dito na lang siya sa imo. So kanala na magyapon siya level of independence na hindi siya mahok gid sa PT. So that's why as PT mo ko na siyang i-consider. But of course, kung yan nakita niya maayo ka nga PT, whether humana na siya pag next time na ada siya other problem, ubalik magina sa imo, di ba? So leads to a decrease in functional mobility and independence. Downward cycles develops of inactivity leading to reduced muscular inefficiency, deconditioning, causing increased symptomatology during exertions, and further abatement of activity in order to avoid discomfort and fatigue. So this is a downward cycle. When you say a downward cycle, kung ang patient mo gani engage sa activity, mapaingon na gani siya sa paubos. As what the statement says. Inactivity, muscular insufficiency, hangtod nga magka ana. So later on manotice niya nga gamay na lang lihok hangako na siya. Sige na lang siya tumar og tabletas, no? So inana mahitabo sa patient. So individuals with impaired exercise tolerance usually benefit from aerobic exercise training and resistance exercise, both of which increase exercise tolerance. Exercises aimed at increasing flexibility are important for improving mobility. So let's not only focus on improving their cardiovascular endurance, but let us also try to focus on increasing the flexibility. Tagan po dato sila mga stretching exercises. Kay bisan unsa to nila na sila kalig-on, physical ay active pero pag ding sa liog ban man ang lawas. So that's not good also. No? So dapat na ay flexibility exercises, especially in older individuals, no? Then coupled with balance training, especially for those who are at risk of falls. No? Dali matumba. So physical interventions for modifying major coronary risk factors. So these are coronary risk factors. Makita nato dira. You have there is hypertension, cigarette smoking, decrease of high density lipoprotein cholesterol, and increase of low density lipoprotein. Look at the management on the opposite side. So these are physical interventions that would address these risk factors. Let's take for example, kung naa siya hypertension, what you will do as PT, monitor the BP during PT sessions. Kung musay mo ning ginag-neglect yun sa PT kasagara. Kay nakuhaan na niya og BP before mag-start, sige na lang padayon na lang. So ang iyang himo na lang ipa-rest o mag-rest, dili na niya bipihan, dili na mag-pulse oxygen sat, diretso na dayon, di na. So we need to monitor the patients during, no? Okay sa gawas ka na sila mga built-in monitors, no, nga itaod lang nila sa patient while doing the exercise. Pero sa ato dili diri pa man kay magbibi ka, mutao pa man kag speed mo, no? Magkuha ka sa respiratory rate, you have to count. So inano siya. So there makita nimo ang management ana opposite. So these are the management or physical interventions that would address this concern, no, on the coronary risk factor area. The next one, okay, so we have here for diabetes, for sedentary lifestyle. So here are the management. For obesity, you notice in the obesity there is exercise, but still there is what? Diet, which is low fat, low cholesterol, high fiber diet. That is a dietary, no nga kwan. So discussion nato sa nutrition, importante kay. So basically sa PT, okay lang tong diet kay dili let's admit it. Gamay ra ang units nato sa nutrition. Matako lang nato ang nutrition when we go with health and wellness. Of course, in other areas, supposedly na pag no, depende na sa teacher. Pero kung sa magid ang atong bread and butter, it's exercise. That's why we are called movement therapist, exercise therapist. So dapat masterado ginato ang exercise. So that's why we have principles of exercise training. Kabalo naman ta na discuss nato last, no? Fit, we have frequency, intensity, uh, so to type and time, no? Time and type, no? Di ba? Na mo to siya, no? Kay double T man to. So karon ato nang isgutan mati. So basic physiological principles, no? So these two na siya dito kaning overload principles, specificity, now na fall na siya dito overload principles sa intensity, ang specificity dito na siya sa type of training, individual variations in training responses, the transient and reversible nature of training, and the progression of the exercise program. So dili kay cardiopulmonary na itong patients na siya ESOB, matrigger ang symptoms, dili na to i-progress ang exercise program niya. Dapat na i-progression. Or na siya dira siya dili siya mag-regress. Dili kay sige ito ano nagkasakit naman na siya. So kung mag-regress na siya, okay lang. Dapat ang atong goal is to maintain or to progress. Ana siya. Application of these principles will optimize the effectiveness of the exercise prescription, and educating patients about them will promote better understanding of exercise and training and improve clinical outcome. So dapat ang exercise nato must create physiologic overload, which occurs as a result of manipulating the four components. So sa ito four components sa atong exercise: frequency, duration, di ba na time, no? Intensity, and mode. Mode refers to the type, no? So inana siya fit gyapon ni siya, pero ang diri gigamit nga term lahi lang. Okay, don't be confused, no? So in such a way that the demands of the exercise are greater than normal. So dapat na siya, no? Target nato na. For resistance exercise, overload is achieved by gradually increasing the weight that is being applied. For aerobic exercise training, the initial focus is on increasing on the exercise duration. Once the duration goal is met, focus is then shifted to increasing the intensity. So if you notice, kung gusto kanimo nga mopusgan ang pasyente, you focus on increasing the weight. That is referring to the load, no? Apply nimo overload principle. Pero kung ang imong gusto is magdugay siya, mulungtad siya nga nagahimo siya sa exercise nga maka-overcome siya sa challenge nga iyang na-experience sa everyday sa iyang activity. Ang iyang na target first is duration. I-increase ang duration sa exercise. And then once the goal in duration is achieved, dito aya pa siya mo-shift sa intensity. So ba't pasabot light lang sa gyud ang exercises. Let's say for example, walking lang sa walking. Nga regular nga walking. Example sa walking nga regular. 5 kilometers per minute. That is a regular walking. 5 kilometers per minute. Yeah, 5 kilometers per minute na walking. Regular na siya. Kay ang brisk na dito siya sa 7 to 8 kilometers per minute mga lakaw. So kanang 5 regular pa na siya. Kung gusto mo mag-start ka 1 or 2 or 3 kanang hinay-hinay na gid siya nga klase sa intensity. So i-progress nimo siya. Let's say for example ang goal nako 5 kilometers kay hinara siya around per minute. So karon i-increase nimo ang duration pila man na siya makuha. Di ba target nimo per minute man? So himuon sa nako ni siya og 10 minutes ay 5 kilometers. The next, ubsan ako ubsan. Oh. Once mo achieve na nako nga goal, musugo na ko po increasing the intensity. So makuha na nako tong 5 kilometers, himo na to nga paubsan na niya ang time hangtod nga magkapaspas na siya, do? Kaya siyempre kung maubos ang time, what happens to the walking speed? Magkapaspas. So hangtod nga mahimo na nako nga ma-achieve na daw kung ang isa ka ang 5 ka kilometro makuha na nako sa 1 minute. So sa una, sa man to 10. So tunga siya. So inana no ang manner. Una 10 lang sa kuan lang sa 10 minutes ang 5. Pag ma-achieve na ko no, mag-set na pud og goal mo na ko ni siya nga paubsan. So inana siya nga klase sa principles no, sa overload principles atong i-apply. Then you have your specificity of training. So training adaptations are highly specific to the type of activity, to the volume and the intensity of the exercise performed. The best effect sa skeletal muscles must be trained in manner similar to the task they are being trained for. And the training should relate directly to the individual goals. Ang puot pasabot ani, let's take for example, kung ang imong patient is an athlete. So, ang iyang muscles na train siya as an athlete. So, dapat ang imong training principle po, dito siya nakafocus. Pili lang kay athlete siya, o niya acute stage, ang iyang case, ang imong goal is pang household activity lang. So, later on, ang muscles siya, dili man design sa inana pa. Dili man na siya mag-deconditions nga ana. So, dapat dito siya nimo i-target pod. Kung ingon niya. So, kung na imong pan is household siya, o household member siya, or ang household activity ra gyud ang iyang ginahimo, ayaw pud tagay og training nga pang-athlete. Dito ra pud siya sa pangbalay nga activity. Kaya dito man siya na-design ang iyang muscles. So, kung tagaan mo na siya pang-athlete activity, siyempre maglisod yun na siya, di ba? So the training program should be designed to meet the specific requirements of different movement patterns within the particular task. For example, the individual wants to return off-road bicycling for exercise and recreation. So training on a stationary or standard cycle would be more appropriate than swimming or jogging. So when evaluating the training effects achieved by an individual, the testing mode should be the same as the training mode whenever possible. So mapugin na. So dapat pareha siya sa ihang training mode o ang testing mode. So let's say for example, kung bike ang ihang activity, so unsa man imong dito? Stationary bike pod, no? Ipa treadmill, ipa treadmill, ipa ergometer, di ba? Ana, nagdina siya. Principle of individual differences. Individuals performing the same exercise program may exhibit very different magnitudes of responses, rates of adaptations. So, dili nato siya i-consider nga kung, let's take for example, bahalag parehan sila athlete. Let's take for example, pareho sila nga basketball player. Or dili, buti pasabot nga kung ang apply na to nga exercise program is the same. So, let's say for example, pareha sila nagkasakit sa heart. Pareha sila nag-triple bypass. So, dili pa pasabot nga kung Ang same exercise program ani sa isa, pare mo ko ihatag na to sa isa. Ug ang response pareha ra pod, dili. Ah, nay uban nga lahi ang ilang response kay physiologically lahi man tanang individual. So, factors that influence an individual response to training include genetic factors, prior level of fitness, rate of progression, and any treatment modification required to meet the needs of each individual. Thus, principles emphasizes the importance of individualizing each exercise prescription. So, ibang pasabot, ang management nato, dili siya parereha tanan na combo. Although we have protocols to follow, akong cardiac patient, mauni siya. Pero ang program within that protocol is different from one another. O dili na to siya i-combo. Ay, pareha bitaw sa musculoskeletal conditions nga, low back pain, hot packs, HMP tens. Dili man siguro, ana, bisan sa low back pain, dili siya dapat inana ang approach. It should be varied because you evaluate the patients, ang manifestation niya is different from the other. So, lahi po ang management. Di ba? Transient and reversible nature of training. Individual stops exercising decrements in physiological functions and performance. There are significant reductions in both metabolic and exercise capacity within 2 weeks of inactivity. A loss of 50% of initial improvement in maximal oxygen consumption or oxygen uptake occurs after 4 to 12 weeks of training, detraining. And there's a return pertaining levels after 10 weeks to 8 months. So you imagine, ka, 4 to 12 weeks nga wala ka nag-train, 50% sa imong initial improvement mawala. Mabakasyon lang ko sa Bahamas. Di ko magpapiti sa nagsuroy-suroy ako dito. So imagine, designan mo na siya exercise program para magbakasyon. Kay tagaan tagag exercise program para during vacation mo. I-emphasize nga mo kay ngano kung dili ka mo exercise during your vacations, that will result to nani. So inana siya class nganong importante kayong exercise, especially sa patient with cardiac problem and pulmonary, no? Cardiac and pulmonary problem. Thus, even among highly trained athletes, the beneficial effect of exercise training are transient and reversible. Of note, a much lower volume of training is required to maintain training effects than is needed to achieve them. For example, a cardiorespiratory endurance can be maintained with a frequency of 2 days per week if training duration and intensity are held constant. And muscle strength and power can be maintained with continued training 1 or 2 times per week. But that could be reversed. Kung mag-stop siya, mo-reverse na within, kasi ingon niya dito, 4 to 12 weeks, 50% na mawala. So this is the effects of inactivity. Muna to siya ganyan na story dito sa awas. This is a downward cycle. No? A downward cycle of inactivity leading to deconditionings. Kung muna siya nga mahitabo, di ba? Ang patient nga na problema sa heart, di na siya ganahan maliho. Magsige na lang siyang puyo. So sa inana niya nga kinaiya, sa may matabo sa iya, mag-decondition. So once nga mo-exert sa effort, ma-feel niya, maglisod naman ko, so sa mo siya nga di na maghimo ana. Hangtod nga magkasige-sige kaubos. Muna usahay ang mga patient nga na ay sakit sa heart, mag-spiral down din na sila. No? Sa time mamatay kung di gid mapas. So these are the adverse effects of prolonged inactivity in different systems of the body. So basically, ang pinaka-affected is cardiac, basically, then the pulmonary, followed by musculoskeletal, central, and metabolic. So muna yung mga problem hitabo. Kung dili ka mag-exercise, o wala kay activity, muna siya. Puro decreasing, wala increasing dira. So rate of progression. The progression of individual exercise program relates to his or her goals, functional exercise capacity, adaptations to the exercise program, health status, and activity preferences. There are three stages, no, sa rate of progressions. The first stage allows the patient to become accustomed to low-level exercise while minimizing the risk of orthopedic injuries. It may be broken down into phases. So, ang sa initial stage, pwede mo siya i-break down into two phase. The first phase consists of interval training 2 or 3 times per day, which the intervals gradually increase in duration and fewer rests are required. So sa first phase, interval training ka. No, interval means na ay exercise, rest, exercise. Pila ganito siya. Ang ratio ani 1:5. 1 minute nga exercise, 5 minute rest, pwede na siya. No? So, at the start. But take note as it gradually increase ang interval. Yan, nag-increase ang duration, nagka-fewer ang rest. So second phase, during which the exercise duration gradually increases to 20 to 30 minutes per session, 3 times per week, at an intensity of 40% to 60% of heart rate reserve. This stage generally lasts about 4 to 6 weeks. So 20 to 30 minutes na. So cycle na siya ha. So dira sa 20 to 30 minutes, di siya kay exercise program. Na ang rest na mo dira. Sa katong last na tong exercise program nga gi-design, nga again, mas taas ang rest compared sa activity. But slowly, later on, ma-reverse, mataas na ang activity time kaysa rest time. Ano siya. The improvement stage aims to intensify the training stimulus by increasing both the duration and the intensity exercise. Exercise duration is increased to a minimum of 30 minutes at a frequency of 4 or 5 times per week. So, yun na siya. So, kani siya nga stage is what? Last for 4 to 8 months. So, sa to first stage, initial. Then you have your improvement stage. Okay, the next one will be maintenance. Muna na siya, no? So kung sa cardiac pa na siya, phase by phase mo na. Phase 1, which is, kasi ganito phase 1, inpatient. Phase 2, no? Ready to out. Diba? Phase 3, outpatient. And phase 4, maintenance. So compliance. Compliance plays a very important role in progressing your patient exercise program. So achieving compliance with an exercise training program is one of the greatest challenges faced by PTs and other professionals. Mao gina atong no, compliance. Ang PT gani di kaya ma-comply og exercise nga normal. Pasyente pa ka nga nay sakit. So mo nang ingon nila nga dapat model kuno ta, no? We are model, so dapat compliant po ta, no, sa atong kabalingon. So typical compliance rates with supervised exercise program is only 50% at best, even lower for independent programs. So with supervision na ha, 50% lang ang compliance. How much more kung wala? So dapat ato gyud i-supervise ang atong patient. Usahay sa rehab na no? Sa musculoskeletal injury. While gadahin mo, sige, exercise na, biyaan lang nato, then maadto ta sa laing pasyente. This is very common sa US, nagtulo ka buok pasyente. Or diri sa Philippines, mo gyapon na. Pero ang problema na to, ang compliance. Ang compliance, di lamang kay nag-exercise siya. Ang compliance, that also includes ang iyang form, sakto ba, ang ba repetitions, okay ba, no? Wala siya ga tikas. Kita gani, tikasan man ta as PT mo ihap, sila pakha nga pasyente. So, ato na siyang tanawon. So, to optimize compliance with an exercise prescription, it is important to recognize the major barriers to increase physical activity so that this can be addressed with each individual and effective strategies worked out in advance. So, success is highly associated with the performance of activities that the individual finds enjoyable. Therefore, it is important to ask questions regarding each patient's interests, abilities, limitations, motivations, and lifestyle preferences. Let's say, for example, if you have a cardiac patient, yeah, mahilig siya sa Zumba. So, saan maning mo para mag-compliance siya sa exercise? You design sa imong exercise program na similar to Zumba. But of course, a little bit lower ang intensity. Mag-comply siya dito sa nga appropriate para sa iya nga conditions or level of functions. Nga na siya. Pero kung ang patient nimo is dili ganahan sa Zumba, ang iha is sa bungero siya. So, imong design yung program. So, mga kag program na somewhat related ko no sa may activities sa bungero di. O padula-dula sa mo dito manok. Ana ba? Nana siya. Dili kay ang atong kuan pahigdaon na nako ni okay dumbbells. Uy, able to stand naman na imong patient, able to walk. Anong ikong i i i ikuan mo siya sa bang ihikot mo siya sa katre. Yeah. Kung pwede siya magawas din ipagawas no dito. But of course, you have to be very careful. No? Kasi gani dapat naka-take niya siya sa iyang needs, no? Especially kung ma-excite on niya siya. So dapat naka-med siya, no? So therefore, it is important to ask questions. Want to say, and then the patient must carefully listen to both what the person says and does not say. Determine the mode of learning that the best suits the individual to provide verbal and written or illustrated instructions. This is very critical, mga portion. Ha? Para makasunsaon nimo po pasabot sa imong client. Patience is required for the individual to may have little prior experience with regular exercise and may not know what will work best without the same trial and error. Other strategies that increase compliance with increasing training include the following. Identify the convenient times and locations, use cues and prompts to stimulate the desired behavior, uh, establish short, long-term goals, and set up behavioral contracts. Cues. No? Dito sa refrigerator, pag dito pagbukas, nakabutang dito, don't eat fried chicken. Eat only apple. Those are cues. Mga, ay, uday, maribad, di ko pwede itayta sa cholesterol. So, ano, those are cues. No? Example. Maintain a record of exercise performed, allow reward for reaching goals, receive positive reinforcement for others, make exercising as social as possible by involving friends, family members, or others with similar medical health conditions so it becomes more difficult to cancel planned workouts. Various authors have demonstrated higher compliance in obese and middle to older age individuals when low intensity rather than moderate intensity exercise is prescribed and intermittent exercise is often preferred. So, ina na siya. So, imo siyang i-akma pag yun. Like, tigulang, tigaan mo high intensity. So, major barriers for increasing physical activity. So, these are the major barriers. Lack of time due to work and family or other commitments. Dili na ma-exercise kay wala ni time. Sa trabaho. Nagkasakit na ganis kasing-kasing trabaho pang na. Cost of equipment. Kay gusto man gyud atong nindot pang gamit. Pwede raman siya makapalit og simple na mga gamit. Poor weather and pollution, lack of nearby facilities, concerns of personal safety when exercising outdoors alone, disability or injury, age, too tired, enjoyment of sedentary behaviors, ganahan si ana, tanaw TV, stress storya, sige ganahan siya sa habit nga reading, magamit na lang computers. So these are the components of an exercise training session. So starts with warm up. Di ba? Ato naman ang nahimo, no? 5 to 10 minutes, low intensity muscle activity para ma-warm up ang muscles, ma-prepare ang heart, ug ang vascular, no? Augment ang blood flow, para na enough oxygen sa muscle tissue. Conditioning. So you have here a circuit exercise about 10 to 15 minutes or more. Utilizing a circuit program as the main component of the exercise session allows easy management and mixability. Pwede po ka mag-interval training, no? Involves alternating between cardiovascular and active recovery exercises. So, ina na siya. So, pwede siya circuit, pwede siya interval. When you say circuit, let's say for example, okay, maghimo lang ta og 5 ka squat, 5 ka dumbbells, o bicep curl, then 5 ka lunges, then we have rest. That's example of circuit. Kung when kag interval, okay, maghimo ta 10 ka squat, then rest. After that, 10 ka squat na pod, rest. That's interval training. No? Then after that, mahuman na to ni siya. We'll proceed to sa another 3 sets sa lunges. Ina na. These are interval training. So remember nga, ang kalahian sa imong exercise compared sa physical activity, ang exercise is na siya ay rhythmical movements. Pattern. Ang physical activity, any activity is considered a physical activity. So it is also encouraged, no? Nga anuan, nga active rest dapat ang himuon, dili complete rest. Active rest means pwede siya maglingkod pero dapat gyud po siya movement. Pwede siya nga magtindog lang siya or magmarcha lang siya in place nga hinay. Para to avoid postural hypotension, no? So example below are circuit programs design. So ano sa circuit programs din nga makita nato. Actually na-upload na nako ni siya sa kuan no, sa classroom. So inyo makita na dito. Oh, so this is an example of exercise program with 1 minute stations. Each of these exercises is performed for 1 minute. Okay? For 1 minute. Pero naa siya rest. So, kani siya nga class. But pasabutan ni, kani sa to nga rest na siya. So, let's review some squats. Common sa squat, rest. Back lunge, rest. Dayon siya balik sa drum. So, number level 1 does not CV and 1 ER. That is active recovery ni cardiovascular exercise ang CV. Sabot pasabot ER station, this is activity station. So squat, rest, back lunge, rest, bike, rest, hamstring curl, rest, side step, rest. So nadra ang duration niya, tanawan ninyo. Cardiovascular is 10 minutes, ay active rest nga 10 minutes. But pasabot, 1 minute exercise, 1 minute rest, 1 minute exercise, 1 minute rest. Kaya 10-10 man siya. So that is example of circuit. 1 minute station naman na tawag. So 1 minute ra pud ang exercise. 1 minute ra pud ang rest. Or you can follow this one. Each station lasts 1 minute. The circuit is completed twice. A whistle is blown 30 seconds into each exercise. Level 1 does 1 cardiovascular exercise, then 1 AR stations. It's 10 minutes. So, muna siya gain na. Muna siya sample. So, sample niya siya. So, dali rigid kain na siya nga exercise. Doon niya na. So, pagkahuman, imo na siyang humanon, no? So, diri na kay active rest. Active rest siya ang imong gihimo. So, level 1, pwede siya only at 8 minutes and 8 minutes nga active rest. So, sa level 2, due to 30 seconds light, then gray 30 seconds, dark gray 12 minutes. So you have here a 4 minutes active rest. So, but pasabot, kani nagkapaspas na sa level 2. Din kani siya level 3. So, ang rest ani niya nagkamubo na siya. So, gain na 1:1. Pwede na siya dayon nga 2 exercises, then 1 active rest. So, inana siya. So, nagkataas ang iyang intensity. Si circuit na siya. So, tuyok na siya. Duha ka tuyok. So, dapat i-balance po ang muscles, no? Di lang kay dapat sa kuan, apil ang lower legs, apil ang upper extremity, di lang po focus sa quadriceps. Apil po na nimo ang abductors o adductors and hamstrings sa exercise. So, kani siya diri, mo siya mga exercises. Okay. So, example lang na, at the start, pwede na siya nga kanira squat down with arms by side. Ang progression niya na is squat with arms reaching forward. So, that is an example of progression sa exercise. Okay. Then you have your hold down, which is 5 to 10 minutes. So, kinalang ko, no? Hinay-hinay lang, dili abra po, no? Hinay-hinay ang pagpa-cool down para mag-dissipate ang body heat and removal sa lactic acid magpadayon. Kaya kung ipalit niyo siya pag-rest, ang removal sa lactic acid mahinay, no namin mapabilin sa muscle, so ang pasyente nimo magka-DOMS. So dapat nahinay lang siya ang pag-rest. Okay, para ma-facilitate ang uptake sa lactic acid nga na-form dito above sa muscles to avoid delayed onset of muscle soreness for patients with cardiovascular or cardiopulmonary conditions. So, this is an example, no? Ano siya? Kani, assignment na siya. May plan of care. Assignment na. So, dito na siya ninyo i-upload sa Google Classroom. Na mo example sa exercise na sa taas. All you have to do is to make it more specific with regards sa case ani nga patient. Na siya tanan diri, ocular inspection, makita ninyo tanan. Oh. So, ana iyang condition. So, isa lang ni siya ka patient, no? So, himuan niyo ni siya og plan of care. Gihatag na ko to siya ng sample last week kung sa akong paghimo sa plan of care. But for those who are absent, it's unlucky for you. So, I hope you will not do that again. Yung sige mong absent sa klase, online and face-to-face. You can ask your classmate about it on how to do this assignment. But of course, mabalaan man ako gyapon na kung naghimo mo na inyo or nangapi lang po sa inyong classmate. Siyempre. So, anak siya class. So, thank you and please make your assignments. Ang due ani dapat before mo end ang December. Ang klase sa December, which is December 23. Thank you.